Hi guys, welcome back to Codemaster Coach, your medical coding tutor. Okay guys, we're still continuing our February series on our CPC review and my most asked questions of me on my YouTube channel. So today's question that I want to answer that is asked of me quite a bit is, do I tab my code books? Do I tab my code books? And the answer is no. No, I don't tab my code books. I had, in preparing for my national certification exams, I had tabbed my code book, and I got in the exam room and was taking the exam, and I remember trying to rush through and trying to answer the questions, and the tabs got in my way. They were all mumbled up and mixed, and I was so nervous trying to get through the exam that I found myself just ripping the tabs out of my book during the exam. And I told myself right then, no more tabs in my book. However, since then, the book tabs are now smaller than what they were back in 2015, 2016, 2017 when I was taking certification exams. And I really appreciate the smaller tabs. So the book came with these tabs, and I do like these much better than the previous tabs. So these are smaller. The ones I had before were really large. So I kind of like the small tab that sticks off. And I stick my tabs at my commonly used main terms or parts of my code book. So like right now I have my guidelines flagged, and I have my alphabetic index flagged, and I have my external cause of injuries index flagged, because you have to really turn through to find where your external cause of injury index is. And so I just tabbed it so it makes it easier to find. And because of these smaller tabs that came with my book, I probably will add them as I use them. But right now, no, I don't tab my books. Maybe I will in the future. Everyone asked me to do a video on it, and I just believe that you tab a book where you need it tabbed. So as of right now, no. If I do decide to tab it, I will video it so you guys can see how I tab my book, my code books. All right, so today, let's answer the 2 questions from yesterday, and I have 2 more for you today. Let's get started. All right, in response to yesterday's questions, first question was, a patient presents with an upper arm abscess in the subcutaneous tissue. That subcutaneous tissue wasn't there for no reason at all. It was purpose driven. An incision and drainage technique is performed. Pus is expressed and dry gauze dressing is applied. The procedure is coded as what? And if you answered A for that question, you were correct. 10060 of the choices that you had. And in response to the answer to your question says, incision and drainage is performed on skin abscess, which is subcutaneous, located on the upper arm in the CPT index. Look for incision and drainage abscess skin in your CPT index. And you refer to the range of codes 10060 through 10061. And when you review those codes in code book, you'll find that the correct code is 10060, because there was one abscess that did not need closure, packing, or a drain place to allow continued drainage. So again, the answer to that first question is 10060A. All right, and on the second question, a 4-year-old is brought into the ER crying. He cannot bend his left arm. He and his brother pulled it while they were wrestling or roughhousing. The physician looked at the x-ray, makes a diagnosis of dislocated nursemaid elbow. The ER physician reduced the elbow, and the patient is able to move his arm again. The patient is referred to the orthopedist for follow-up care. So what CPT and ICD-9 code should be reported? Hopefully you got it. A, 24640 modifier 54 is the procedure. S53.032A is the diagnosis for the nursemaid elbow, and Y93.83 is the external cause code. All right, in answer, in the CPT index, you look for elbow, dislocation, closed, treatment. And it gives you a range of codes 24600 through 24605 and 24640. And when you review the codes, you choose the appropriate service. The correct code is 24640 to report a child with a dislocated nursemaid elbow, and the physician manipulated or reduced it successfully. So in your ICD-10 alphabetic index, you look for nursemaid elbow, which gives you code S53.03, and that line lets you know there's additional digits to apply to this code, guys. So in your tabular list, you look up that code S53.03, and it tells you number 2 is selected because it's the left arm that's affected. So this code requires a 7th character. So hopefully you captured that 7th character. The 7th character A is selected because this is an ED visit, which means it's an initial encounter. So in your ICD-10 external cause of injuries index, we're going to be looking for pulling excessive, and it gives you Y93. Y93 is a category for reporting the activity. So in your external cause of injuries index, for activity, roughhousing, and horseplay, you get Y93.83. And when you verify the code in the tabular list, you're going to attach modifier 54 to report that the physician performed the surgical portion of the service. Okay, so on your answers, that procedure 24640 modifier 54, you're identifying the fact that your physician performed the services. But hopefully you guys got A correct. All right, you ready for today's question? All right, today says, a patient with hypertension and chronic kidney disease stage 5 is admitted by his primary care physician. What ICD-10-CM code or codes are or is reported? Is it I-10, I-12, I-10 and N18.5, or I-12.0 and N18.5? Again, the question is, a patient with hypertension and chronic kidney disease stage 5 is admitted by his primary care physician. What ICD-10-CM codes are reported? And there are your choices. And your second question for today. When a service having both a technical and a professional component, such as an x-ray, is performed in the hospital, which modifier would be used by the physician? Is it modifier 26, modifier 47, modifier TC, or modifier AM? When a service having both a technical and a professional component, such as an x-ray, is performed in the hospital, which modifier would be used by the physician? 26, 47, TC, or AM? Okay, guys, those are your questions for today. I'll be back tomorrow. Thanks.